it will be very complicated to us to answer, but we can answer for classical answers, classical questions.
What for you?
If there is no question about a question about it? Do you have some questions at least? So maybe we can just ask questions. You have like a big consultation, a free big consultation with all specialists. So feel free to ask questions. There is no stupid question. Every question has an answer. Even if you don't know exactly the issue, but we can answer at least. So we can try to answer your question and to help. Of course, there is no real truth. Yes.
Okay. Elle sera en français ma question, désolée. Je voulais savoir, j'en ai discuté avec certains tout à l'heure, au niveau de la recherche biologique, est-ce qu'on a complètement abandonné les facteurs environnementaux ou autres qui pourraient intervenir dans ce gène? Merci.
So you were just asking about environmental factors that could be involved in this. So the question is quite complicated because it's always a difficult research to search about environmental factors, because at the time we don't have really very good orientation for that, and usually these kind of factors are investigated not in specific direction for Aniridi. So this is not my field of action, and to my knowledge there is not a specific research for factors just that underwent in Aniridi, and I don't think my colleagues have something specific. So at least the research is probably done about environment, not specifically Aniridi. So, do you want to answer maybe for that question, or do you have any idea?
I mean, I can comment on that. I mean, I can comment on that. It's clear that gene-environment interaction does play an important role in strength of phenotype and so forth. Now, an important limiting factor is that for disease genes, it is not trivial. It requires that you keep the environment controlled and that you look at, okay, what factors have been suggested to play a role, and then test them individually and see how they may impact the severity of the phenotype. As I mentioned in my presentation yesterday, I mean, I work with Drosophila there. It's a little bit easier with the fruit fly to control that and to actually ask, okay, how does the environment impact the expressivity of a particular genetic defect? So, and I believe that for the eye in general, that people are looking at all kinds of environmental insults, but probably less so in conjunction with the genetic predispositions.
Thank you. All the speakers can go here if you would like. You can go.
To speaker on the right hand, please.
So my question is not directly related to a specific session. What I'm confronted with is atrophy of the ciliary body, causing low eye pressures. So my question is, do you see there any treatments for that? Should that be a sign not to undertake other treatments like things like stem cell transplantation, etc. And a last related question, can this give a rise to pain episodes that last for 1 or 2 days and happening every 2 weeks, let's say?
Can you stand up? Sorry, just can you stand? Okay. You were so far, so we didn't see you. So the question is if we can add treatment in some specific situation as pain.
Yes, well, in the case of atrophy of the ciliary body, which causes low eye pressure, 2, 3, or even lower, are there treatments for that you see? And then the related questions were, should that be an indication not to undertake other surgeries, for example, and is this a cause of pain episodes? That were 3 questions that I had. But the first question, the most important, is there a treatment?
Well, for pain related to high atrophy, amniotic membrane transplantation may be useful. It has an effect, a strong effect on pain, and that's a technique I use sometimes for other cause of high atrophy related to hypotony, and I think that it can be useful. It's a conservative treatment, and it can relieve pain.
Another question, thank you.
Hello, I have a question about hazy corneas, which in some patients, even after the pressure is regulated with Ahmed valves, the corneal haziness remains, but especially at small children, there's some possibility the cornea somehow to regenerate. My question is if your experience, there is some kind of way to help the cornea to recover from itself, and especially with small children under the age of 4. If there is some way how can you help this, in case my son, for example, which he was born with very hazy corneas, now 3 years later, his situation is much better, but due to the structure of the cornea, which is very deformed to thickness of 1 millimeter cornea, it's still some haziness there, but we are searching a way how to help him, the cornea to regenerate from itself. There is such a way, because the literature says there is no such a things. Like the endothelium, if it's damaged, there is no way how to be recovered. But the experience shows the opposite.
Well, first you must know what's the reason for increased corneal thickness. It's likely that it's endothelial decompensation, which is not part of Aniridi high damage. It's maybe linked to other mutations that will impair the corneal endothelium function. And so you have some cases of aniridia which are not related to axis mutations that can include corneal edema related to endothelial decompensation.
In our case, it's also FOXC1, a very rare case of aniridia, which is also with this.
It's not exactly the same gene. Yeah. That's why it's probably different. And the other point is the question: how with the pressure?
The pressure, it's almost impossible to measure in a normal ways, even with a general anesthesia and 5 different types of measuring the pressure. It's always a question mark if this is correct or not, and only with fingers touching the eye, it's the way how we can establish and say the pressure is okay or not okay. And we're so simply looking
at treatment for the glaucoma or not?
Yeah, of course, with the Ahmed valves.
So when you have a glaucoma, it's changing also the cornea, and the regeneration is different. So that's why you're probably a very complex case for your child, and that's why it's very difficult to understand the evolution of the cornea without seeing the case, because you can recover and approach also for the cornea. It's different than Aniridi PAC6 positive. So that's why it appears for you, you have an improvement, but it's probably not related to the PAC6 anomaly. It's probably related to something else that Professor Goddard said, and so that's why it appears difficult. So we don't have a solution to give you today without seeing the case and without understanding exactly the opacity of the cornea from what causes.
We tried, just one last thing, we tried with ODM5 and coronary gel and other kind of drops somehow to help the eye. If this brings something, I don't know, cannot say, but it's this what we see the last year is that progressively it's better and better. Hopefully we'll stay like that.
I would like to say that we have had some case like this, and in our clinic we were waiting 1 year. There was no changes in cornea because probably we don't know the case, but if there is a 1000 microns thick cornea, it's quite really difficult to regenerate. And so we decided to remove the valve because there is an Ahmed tube, yeah? And we did the corneal transplant because the anterior chamber probably is really shallow, so there is no other way, in my opinion. I don't know, but the case. But if there is no progression to in the cornea clarity, so I think it's the other way. I don't know what you think. But we did one case like this. It was 6 years old boy. And the Ahmed valve was done when he was 3.
In this case, the Ahmed valve is essential because there is no other way how you can regulate the pressure. So the transplantation, it's no question. I say in this case, the Ahmed valve is very essential to regulate the pressure. And with keratoplasty, it's not in question. It's the chance to succeed. It's less than 1%.
And what is the visual acuity of you?
No, nobody can say. He doesn't speak.
Okay.
As a question?
The one systemic deficiency related to aniridia. Is there someone that have a question about that? About syndrome? Okay. Can you stand up and
Hello?
Yes, very good.
I'm a parent to sporadic aniridia, and I've been a member of the Norwegian Union for the Families started. And I have a wish that somebody could be interested in the other things about aniridia than just the eyes, because it's much more. It's a problem with obesity, is that right?
Diabetes?
Overweight, yes. And problems to learning problems, and also problems with the hearing, or other noises get very loud, so it's difficult in the education situation, and small sleeping problems. It's much, you see, you can see that the children are liking in some ways, and as a parent, I wish for that you could have more education, you have more knowledge when you get a child with aniridia. And the only thing they are interested in is the eyes. The only thing they tell you is your child has a problem with the eyes. As a parent, it's
different.
It's struggling all the time, and the children have a lot of they are tough. They do everything they can. They want to go to school. They want to learn things. They want to do everything. But certainly they struggle to do something because, and we get no help with that. Why?
You're absolutely right, and your question is really very interesting. That's why in the meeting you have seen we have different points about research on sleeping, for instance, and research on neurologic problems. That's why we are also working on the guidelines. So we are working on the guidelines. There is already guidelines in Italy, guidelines in Spain. And so we are working for guidelines also, it's on the way in France, it's quite finished. And also we will do that at the European level. And these guidelines will be for parents, for doctors, doctors that see just one Aniridi by their career. And so that's what we are working on that. And unfortunately, it's, of course, we cannot be parents, but we really understand the problems. And so that guidelines will be interesting to be diffused everywhere for every people that want to have more information about Aniridi.
That's one of the success of association of patients taking together professionals and patients and families, because in France we see we have regular meeting of the association, and that kinds of problems are very often discussed in the meetings. So I think that's a success of this process, taking together patients and researchers and doctors. And as you could see at the last session, there was a lot of questions that was unexpected in a small meeting in Sunday morning. And the reason why there is such discussion is probably that not only professionals are in this room, but also patients and families. So don't worry, we are aware of the problems that you mentioned, and there is really a huge amount of work to try to fix the problems. However, they are difficult to fix, and progresses go slowly, but they are ongoing.
Could I get a comment? We have our large cohort of patients in Russia. They are about 200 now, and we see these complications concerning to other systems, neurology, central nervous system complications, diabetes, obesity, and others. And we see frequencies of these complications and try to prove that they are more frequent, these complications, than in general population. But it's impossible, because in Russia nobody knows these frequencies of these perhaps little decrease of it's really little decrease in some people and more larger in others. So we don't have these figures Do you have in France, in Europe, these figures for general populations concerning to these frequencies of complications typical in Aniridi?
That's one part of the work, because we need a real large population to just study that, and we need to make research projects. But we are working on these points, and you know there is some publication about the epidemiology is probably more difficult. But what is important is that the population know that there is something to know about this complication and those complications that are added to the eye problems. And so we don't have much time, so I think there is 2 more questions, and after, or 3 more questions, and after we will finish that, and we will discuss outside after the conclusion. Thank you. Yes, you can go.
I am from Ireland, Irish Republic, but from age 19 have been in the UK. I didn't know anything about an association like this until 2 years ago. Now my frustration is finding a specialist in the UK who could really understand and deal with Aniridi. I am sent to one person for a cataract problem, somebody else for glaucoma, somebody else for cornea. Now my current problem is loss of vision, but this is due to ptosis rather than my vision deteriorating further. And again, I didn't hear much discussion about ptosis over the past 2 days. I'm just wondering how you can assist with my personal frustrations in terms of locating specialists.
Okay, so I'm not an ophthalmologist, I'm a scientist, but I do know, for example, Moorfields Eye Hospital in London looks after the largest cohort of Aniridi patients. Many patients are referred to Moorfields. I can't say that you wouldn't be sent to different people for different specialities, because that's how, generally, if you have glaucoma, you would go to a glaucoma consultant. If it's a cornea problem, you go to an external diseases expert. But we were talking about maybe the next meeting is thinking about cross boundaries of the different aspects of Aniridi, maybe a topic that people would like to see in a meeting that brings together scientists and clinicians from different disciplines. But I think, in reality, as my understanding is, patients will go to the person that's best suited for that particular thing, and we don't have an eyeball doctor, if you like, that would look after all of that.
Because I am actually a patient of Moorfields Eye Hospital.
Okay.
Since I've been 19.
Okay, so you
I
know.
feel as though the best support I have had in terms of arresting my Aniridi condition as such has been through the glaucoma clinic rather than any other clinic. But I appreciate what you're saying. I just thought it was worth. I don't know whether any of the panel do actually know of any specialists in the Irish Republic who are specialising in Aniridi research, because again, I'd like to be able to try and identify them. Mostly, again, I'm just told they're concerned with pediatric ophthalmology, which again is frustrating.
I'm not sure, but I can certainly ask colleagues for you.
Thank you very much.
You're welcome.
I will just answer to Norwegian lady. We have now a lot of scientists who study this Aniridi as a syndrome. So our scientists, they study, we have an AFI, American Foundation International, they study, we have Dr. Lauderville, I don't know if you're there, or is still in this. Yeah, so he did fantastic research about the brain system, and he's with the students since long time. And we have some another doctors in USA, they study metabolism, they study sleeping problems, they study level of melatonin, a lot of things done since long time, since 2013 when I went to the conference in USA. So it's not like there's a scientist, they are studying. The only problem, sometimes we cannot have all scientists in one conference. So this is why you can travel from conference to take information. So for example, now we don't have some specialists, except Dr. Lauderdale who can speak about this, but next conference we may invite them.
I want to say, why not use some time for this topic on the next conference? And then you also have the possibility to study some of the patients that come.
Just to connect. That's why we have this kind of conferences. And there was also Professor Bailly-Buisson for the neurologic system. And so we are all working on that. What is difficult is that we are publishing, we are discussing, we are doing some research, but for the public, for patients, it's not visible. That's why I would just answer with guidelines, because the guidelines will be for everybody. It will be, of course, for doctors also that don't know about the disease, but it will be also for the patients. I understand you cannot go and be a researcher and see all the literature every day. That's not possible. We are continuously working on it, for sure. It is not visible. That's why we try to do guidelines. And I can assure you, we know we are aware of it and we work on it. That's why we have some kind of different talk about that.
Yes, and that's very good what you're saying there. But I wish for the next conference, why not use a little bit of the time for this issue?
Five more minutes, but after we stop. Okay, so be short for the questions, and we'll be happy to answer, and my colleagues also, of course.
Yeah.
Okay, sorry. Oh, sorry.
First, I really want to thank all of you for this conference and the work that you do. I learned so much in these past 2 days. It was really good to be here. I have two questions that are extensions of previous talks, but they are short. First question is about the environment, the best kind of environment that you can live in when you have Aniridi. So I know that you should not live in a dry environment. I'm just wondering, should it be just like a humid environment or a sunny environment but humid is okay, or is it better to live without sun as much as possible to be exposed to the sun? And also, what about like pollution or cigarette smoke, or how does this have an impact on cornea? And my second question is about hearing problems related to Aniridi. Is there any treatment or evolution development regarding this issue? Thank you.
Thank you very much for the question. It's always very difficult because we cannot send all the Aniridi patients just in one part of the world and there is no. It's a nightmare because everybody is leaving where they are and leave your life. And so we answer about that. Of course, humidity is a good way, but if you live in France, you live in France.
No pollution.
No pollution, of course, in Paris, so it's a wish. It's a wish, but I don't know the exact part where it's the best to live. So I can't answer exactly. That's interesting. For the second question, there's something to better the environment. Also, we live with the environment. We live with the pollution. We live with the humidity or not. And so the only point is sometimes you have some glasses with the humid system, for instance. But it's so complicated. So at the time we don't have a real simple system to propose. Is that also to the question?
In a way, there are some studies talking about scleral lens. That, you know, this lens is a kind of contact lens that doesn't touch the cornea, but that preserve a liquid interface between the lens and the cornea, and it kind of protects the cornea from the environment. It treats, for example, patients with very severe dry eye, and in Aniridi keratopathy, you have intense turnover of the epithelium, and maybe the fact to kind of reserve the cornea in a separate environment, it may preserve. However, there is few data on that. There are also conflicting data in specialists, because we have debate, and some are saying that it may be pro-inflammatory, inducing inflammation. Some other, there's one publication in an optometry, in an American Journal of Optometry, with a long-term follow-up in only one patient, and in this patient there was 5-year follow-up in one eye and 3-year follow-up in the other eye, and they suggest that it may stop the evolution. In a way, it's a good concept to maybe predict like scleral lens in this situation they have, but no data, no convincing data.
Is it really the last question now?
Yes, thank you. My name is Sylvie. I'm from Norway. I have a husband, a daughter, and a son with Aniridi. My daughter was had her glaucoma surgery when she was 12, and when she was 16. And she had amad tubes in her eyes. What's happening now is that these tubes have started to move against the surface. They haven't broke the surface yet, but these are certainly painful. And I'm wondering, what options are there for these problems? Can these tubes be replaced? Can they be, so to speak, moved back? Or what are the options for these problems?
Well, there are possibilities to perform peripheral corneal scleral grafts to protect the tube. That's a procedure that is minimally invasive, and that could help probably in your case. In very unique cases, sometimes an amniotic membrane graft can fix the problem, but if there is really a defect of stromal tissue, the corneal graft could be useful. Of course, it's not a conventional corneal transplantation. It's just to put tissue over the tube to reinforce the eye.
Okay. So thank you very much. I think we will go on the conclusion, and if you want to.
Excuse me, can I ask something? Yeah, I have two things to say. First, I agree with the non-ocular complaints in positive access patients. I think there are two big problems in my experience. So the first is there are rarely neurologists and endocrinologists being aware about the possibility of systemic deficiencies in access positive patients. So I think there are also associations for neurologists and endocrinologists. Maybe they can give them some more information about it, so they will be more aware about it. A second thing is now, in my experience, you consult clinicians, endocrinologists, and neurologists. They say, oh, actually, I don't know anything about access, and as far as we know, access has nothing to do with hormones, endocrinologists, or metabolic things. While we now, today and yesterday, we heard it is. So it's a problem probably, I'm sure, there are a lot of, well, not all, but there are a lot of patients, they have also non-ocular complaints, but now they consult some doctors, they don't know anything about it, and they say, oh, we can't help you, maybe you are depressive or something, because it's easy to say that if they don't know it. So that are the two big problems, I think, about it. Then the second thing, I have a question about the stem cell transplantations. Did I understand well that if the niches, the polycells of Vogt, are not functioning well, what's the case mostly in PAX mutation, then stem cell transplantation is on long term not effective?
For the first thing, just I have something to answer. This is, Aniridia is a rare disease. So, you know, there is more than 7,000 rare diseases. So you can understand easily that every doctor cannot know everything about every rare disease. That's why we are working on guidelines. Second point, you can answer very quickly.
If I understand the question correctly, you said that the fact that the stem cell niche is affected will impair the potential benefit of cell therapy. It's what you said? It was a question?
Yeah, it was a question.
In that case, I'm not going to answer based on Aniridia data, but for example, Panorama left, but they have published a large amount of long-term data on cell therapy following alkali burn injury. It's a very severe alkali burn on the ocular surface with no preservation at all of the niche, and they published several years ago more than 12 years of follow-up in this case, so it works. If cell therapy is proposed, it will work even in the absence of stem cell niche.
So, but there is no sense to do a stem cell transplantation if the niche is not functioning?
No, it's the opposite what I said.
Okay. Sorry, can I say something? The difference between the eye. So this is not possible in Aniridia, and this is why these stem cell grafts are failing their allogeneic stem cells, and in the long term they're not. Yeah.
Okay.
You know, we used some years ago in Poland, we had a project with oral mucosa transplantation for the Aniridia patients with stem cell deficiency. So this is the way we can get the stem cells to restore the corneal surface in Aniridia. So we could do that from the oral cavity actually. I don't know if you're studying this kind of literature, but it is possible, and we did it over 30 cases like this, and we also did a paper with some results. I don't want to
So
make
I
it
thank
longer.
you really for the question and the answers. Just we are running out of time, and so thank you. We will go to the conclusion. Thank you very much for the questions.